Go ahead and get started here. I'm sure we'll have people joining a few minutes into it here. But just kind of wanted to start off with saying welcome, good afternoon, and thank you for everybody who's joining us on this call today for this Health eFormatics webinar, Replacing Your EHR, Don't Leave Your Data Behind. A couple of quick housekeeping notes before we get started with the presentation here. This webinar is being recorded, and so we will be distributing the recorded link and also the slide deck shortly after the presentation here, so you'll get that emailed to you. There also is a raise hand feature within GoToWebinar, and so if you do have a question that you'd like to ask, you can do it through via that raise hand feature, and I can unmute you, and then you can state your question. Or there's also a questions area within here. So if you type your question in there, you know, when there's a break in the slides, I'll periodically check that out to see if we had any questions on the slide that I just spoke about there. So feel free to utilize either of those, the raise hand or the ask questions feature, and hopefully I'll be able to address your questions. So to start, I'd like to just introduce myself. My name is Brad Benson. I'm the president and CEO of a company called Health eFormatics. We're a Chicago-based healthcare IT company that specializes in EMR conversion, PM conversion, and archiving solutions for EMRs and other various health electronic systems. So our company has been in business for about 9 years now, and we've performed conversions for several, anything from 1 and 2 doc shops to large university health networks. We've worked with, being in business 9 years, we've worked with most of the major EMR systems out there in one capacity or another, and been performing migrations, as I mentioned, for the last 9 years here. So I assume that most of the folks on this call have either are thinking about EMR conversion. Maybe you're acquiring practices where you're pulling in, need to pull in legacy EMRs into your current EMR system within your organization, or maybe you're actually currently going through one right now and would like to get a little more information about it. So what I'm going to be covering over the next 45 minutes or so here is I'm going to be talking to you about, what are the reasons people are changing EMRs? What are some of the common questions that you need to be thinking about in regard to the data migration portion of your EMR conversion? What are the different options that are available to you? What are the pros and cons of each of those options, and what's the impact of each of those options? And then I'll follow up with we'll finish with a case study of a organization that has been utilizing the PatientArchive product of ours for their migrations, and then I'll give you a quick demo of the PatientArchive product as well. So to get started here, I mentioned what reasons why physicians are changing EHRs. There was a Black Book ranking study that came out, I believe, last year, and the top 4 reasons that that organizations were changing EHRs was around dissatisfaction. Dissatisfaction either with the functionality of their current EHR, maybe it didn't have all the features that they were promised, maybe the level of support of the EMR vendor wasn't up to their satisfaction, and so a number of organizations are looking to switch EHRs to find something that is going to suit their needs better. Some of the reasons that we commonly hear why physicians are changing is due to acquisitions, which I mentioned. If there's a legacy, if there's an acquisition of a practice and they're on a particular EMR, the organization then needs to figure out, what do you do with that data? What are my options for that? And then some folks are looking to move to a meaningful use certified system, so perhaps the first one that they were on isn't keeping up with MU certification, and so they're looking to find one that is. And a third common example that we hear is folks who are looking to move to a consolidated system. So they may be bringing several different health system or electronic health system together into a single system. So we'll hear of folks moving to an EMR, a new EMR for that reason as well. So there are a lot of our customers who come to us and they don't really know where to begin. They've either purchased a new EMR or they're about to purchase a new EMR, and so they'll come to us and say, I know I need to do something with my data, but I don't know what. I don't know what my options are. I don't know the questions that I need to be asking and the things that I need to be thinking about. So I wanted to share with you guys some of the things that you do need to be thinking about based on the experience that we've had with conversions. Some of these are fairly obvious, but maybe there's some things in here that you haven't thought about yet. So the first question, pretty simple. What needs to be migrated? So what are you trying to accomplish with the data conversion? Do you need to bring everything out of your old EMR and put it into your new EMR? Is there really only a portion of the data that you're concerned or that you'd like to actually bring into the new EMR, and then do you want to do something else with the rest of the data? And I'll talk about some of your options there as well. You need to be thinking about the quality of the data. So what is the real quality of the data that you currently have in your EHR? A lot of folks may think that they have coded data within their system there, but when they go to pull that data out, they realize that they may have a lot of free text data that's going to be difficult to convert over to a new system. So that's one of the things you'll need to address and make sure you have clarification on is the quality of the data. What should I migrate and what should simply be archived? So the archival is an option that you have there that I'll talk about in a little more detail in a minute. So a lot of folks who we work with, a lot of organizations that we work with, they limit what they actually migrate into the target system. Typically you'll see like problems, allergies, meds, immunizations that if it's possible to migrate those over and actually put them in the target system. And then they may take the rest of their data and just stick that in an archive, which is then accessible, but it doesn't actually live, the data doesn't actually live within their new EMR system there. How are you going to retain the full legal record? So you have a responsibility to maintain the rest of that data for between 7 and 21 years, and depending upon the state requirements there and whether it's pediatric or adult. So you need to think about what is the full legal record, for your organization there, and how are you going to make sure that you're at the very least preserving that and able to produce that information as needed. And then finally, what is the appropriate migration solution based on your particular needs and timeline and budget? Organizations have different requirements for their conversions, and oftentimes, they may have a certain amount set aside for the conversion portion, and you need to figure out, based on your needs, your timeline, your budget, what makes sense in terms of a migration for you. And so what I'm going to talk to you guys about today to hopefully give you a little bit of better understanding is what are the options that you have to really customize your solution according to your needs, timeline, and your budget. So before I get into really talking about each of the options there, I want to bring this slide to talk about this slide for a minute. We oftentimes have folks who will come to us and they'll say, I just need to preserve my data. I'm not looking to do a full conversion. I don't even want my old data in my my new EHR system, but I need to preserve it. And so, can you just put it into a summary document for me that I can attach to the person's chart? And there's a lot of reasons you don't want to do that. For one, once you take that data, which is discrete data sitting in an EMR system. And once you take that data and you put that into a PDF or a non-discrete format, and for folks on the call who may not be familiar with the term discrete, it really just means that data sits in a table somewhere where you can query that data. So the difference between just that being discrete versus non-discrete data sitting in a PDF file, you can't report on it or pull that information out of there very easily without pulling it up and looking at it. So once you take that data from an EMR and put it in non-discrete format, it's very difficult, if not impossible, to go back to making that data discrete. So if you were to put it all in PDFs, stop your licensing on your old EMR, now you have no way to pull that data out and query it and report on it. It's only good for viewing. So a couple other reasons why you'd want to keep that data discrete is the EMR functionality runs against that data. So things like drug interaction checking or allergy reminders, that requires your current medication list, your current allergy list to be within that within the patient's chart there. And if you put it in a PDF and stick it in their documents section, that particular functionality isn't going to be able to run against that patient's critical information there. The final two things that I wanted to mention was the historical reporting, so PQRS and meaningful use. Those require reports to be generated that pulls this discrete information. That's something that a lot of organizations are going to require, is the need to be able to continue to do that on that legacy data. And then finally here, business intelligence and predictive analytics. This is becoming more and more critical for organizations, especially ones that are part of an ACO, and needing to be able to create actionable intelligence out of the trends within their healthcare data. And this is going to become more and more important for healthcare organizations over the years. And so, you want to make sure that all the data that you have, if you can keep it discrete, that is definitely going to be desirable and beneficial for your organization in the long run. Take a quick drink of water here. So I mentioned that you had a number of different options, and there's three that I want to talk about today. You notice I didn't have the summary document in here that we talked about, where it's non-discrete as a PDF. It is an option. It's not one that we typically do or recommend. So I want to talk about the options of how do you get your data, how do you make sure that it's retained discretely in some form or fashion somewhere within your system, and then also what are those options there, so for doing that and retaining your full legal record. So the options I'm going to talk about are manual entry, which is probably the most arduous of the three, definitely. But that is, I'll talk a little bit about that, but that is where you're basically typing the information from your old EMR into your new EMR. And then the other two I'm going to talk about are the programmatic ways to do this. So discrete data conversion has a number of different methods that you can use for migrating your data out of your old EHR and putting it into your new EHR. And then a legacy EHR data archive, that is where you're taking your data and not putting it in your new EMR, but putting it in an archive area, which is oftentimes accessible from your new EHR. So it's almost as if the data lives right there and you can access it with a single click, but you don't have to go through the process of mapping and making sure all the fields line up with putting your data into your new EHR. So talking about the first one here, just manual entry, as I mentioned, this is really just hand typing the data from your old EMR and into your new EMR. The pro side of that is, you do get that full EMR functionality that I mentioned, the drug interaction checking and the allergy reminders on your data, because you're actually putting it in. It's just as if you entered it into your new system. And then you have the ease of access. So your data is not sitting in a PDF, a 30-page PDF file somewhere that you got to scroll through. It's right there within your problems list, allergies list, etc. The downside to this effort or to this option is obviously that it can take a very long time, and it's resource intensive. You may have to pull up the patient chart in the old system on the day that they're coming in, and then hand key everything over to the target system there. It is an option, but it's also very prone to error in terms of manually entering that information. It's going to take a very long time. So depending upon your timeline that you have to do this, etc., it's typically it's not something that people do, but I do mention it because it is a way to get your data over to the new system discreetly. So the other options that I want to talk about is the discrete data conversion, where I mentioned this is where you're electronically transferring your data from your old EMR into your new EMR. So it's physically going, that it is, at the end of the day, it's going to physically reside in your new database. And there's a number of different methods for doing this. You can use an HL7 interface to put the data into your target system there. You can use CCD. That's a very common way of exchanging data between EMRs today. It's going to be becoming more and more as EMR vendors become more mature in their import process. They're going to continue to develop the ability to import more and more data via CCD. So that's a common one that we use for importing data discretely into an EMR. And some of the pros of that are obviously the full EMR functionality that I talked about. The legacy data is easily accessible. Now the data, it does reside in those patient list and allergy list areas that you would expect within the new EMR. And there's a high degree of accuracy, so you don't have the human error element that was involved with the manual migration there. And then your legacy data can continue to be incorporated for clinical intelligence purposes. So you're not putting your data in the PDF, as we talked about. This data is queryable. You can look for trends within the data, pull this into your data warehouse, etc. So many pros. I mean, if you have the budget for it and you have the timeline for it, etc. This is definitely the best option in terms of usability of the data. But typically, and I'll talk about this in a minute, a typical solution uses, this is a part of the solution, but it's not the entire solution, and I'll describe that and why that is in a minute. So some of the cons of a discrete data conversion is it can be cost prohibitive especially for smaller practices. Depending upon the EMRs that you're dealing with and the compatibility between those two EMRs, it can be a pretty complex process to pull all the data out of the old system there, to map all the data, to put it in the appropriate format for import, doing your testing, validation, etc. It can be a fairly lengthy process, especially if it's, like I said, between two EMRs that aren't very compatible with each other. And then the second con to it is that it does require a good amount of conversion expertise. This typically isn't something that organizations are going to want to take on by themselves. It's typically something that typically folks call a company like ourselves when they're in need of conversion services, because it is complex and it's something you want to make sure that you're doing it right. Because of the criticality of making sure your data is brought over appropriately. So the third option I'm going to talk about is the clinical information being stored within an archive. And as I mentioned, it's typically accessible directly from a new EMR, and that's the demo that we're going to show today. To show basically what a legacy EMR data archive looks like and how you use it. This is what's happening here is you're taking the data out of your target system discretely. You're using queries. You're pulling the data, and you're putting it into a different location than your new EMR. The way PatientArchive works is it's put into a SQL Server database. And then there's just a link from your new EMR. So let's say patient Susie Smith is in your new EMR. There's a link associated between that patient Susie Smith and her data that sits in the legacy archive. And it can be represented a number of ways in terms of how you get to that archive, but it's typically just a button or a link or a tab that you can click within your EMR, and most of the major EMRs out there allow the ability to call out to an archive solution. And so it's just a link in there, and then it will pull up all of Susie Smith's legacy information. And some of the pros around that are this is really the most cost-effective conversion solution. As I mentioned, you don't have to go through the process involved with the discrete data conversion. It's truly just extracting the data, dumping it into an archive, and then really formatting it to the way that you would like to see it. You also get the benefit of the ease of access. You don't have to it doesn't require you to log into another system. Typically, the authentication can occur right from the EMR. It just loads the archive viewer there and can view their information with a single click. And it's typically a very fast implementation time. The projects that our patient archive projects that we do, typical implementation time is anywhere from 4 to 6 weeks. And you may have an 8-week implementation time on the higher end there. But so it's pretty quick, in terms of pulling that data out and getting it in the archive and making it viewable to the end user there. The data remains discrete. As I mentioned, it's stored in SQL tables, so all that data can be reported on. There's now, you're not losing that discreteness of the data. And then you can take all the data within your archive, and if you have a data warehouse for business intelligence and predictive analytics, you can put that data into your data warehouse as well. And one of the beauties of the archive is that it allows you to take that information that you may not be able to get into your target system and put the rest of it in the archive so that you can retain that full legal record without having to pay the licensing to keep that legacy EMR up and running. And I'm going to talk about in our case study an organization that was able to do this with a number of different systems within the organization that they were paying ongoing maintenance and licensing on, and show why that was so beneficial for them. The only downside, really, to the legacy EMR data archive is that full EMR functionality is not going to occur on your legacy data. So as I mentioned, the allergy reminders and the drug interaction checking aren't going to occur on if your medications and allergies are stored within your legacy archive. So that leads me to my next slide, which is going to talk about what do you do about that. You don't it's a critical thing that you want to have that functionality occurring on that particular data. So what we typically do is most of the conversions that we do are hybrid conversions, where it's a combination of discrete and archive. And a typical solution is really, as I mentioned, making sure that anywhere where there is that EMR functionality, we'd like to do that discretely. So oftentimes what we'll do is we'll do a problems, allergies, meds, and immunization migration discretely into the target system, and then everything else will be put into the data archive. And there's a lot of benefits from that. Essentially all the pros that I went through in the previous slides there, you get all of those pros. And so it's a common solution that we do. And it typically fits all the needs of being able to retain the full legal record, all the reporting, future reporting needs, as well as what was the third one that I mentioned there? Sorry. Oh, easily accessing the data. So the hybrid solution allows you to figure out what's the appropriate solution or the appropriate option for each of your individual data elements there. And I won't get into some of the, there may be, you may want to look at the quality of the data that exists within your allergies, let's say, or your problems list, how is the quality of the data to decide whether it makes sense to do a discrete migration into the EMR or just put it into a data archive there. So this slide just kind of highlights basically what I just talked about there, where typical EHR data migration is going to be where you're taking your discrete, those four main discrete elements, allergies, meds, problems, and immunizations, and then within the legacy EMR data archive, placing your scanned images, your progress notes, your histories, lab results, vitals, etc. And we've done migrations where there's up to, it could be up to 25 or 30 different data elements that organizations are wanting to pull out of their old EMR there. So what are the key factors that you need to be considering as you're putting together this data migration plan for the organization? Just kind of wanted to highlight some of these things. So really understanding what the requirements are from all of the stakeholders here. So what do the physicians need in terms of being able to do their job appropriately? What is the critical data elements that they need to be within the target system there? What needs to, what data elements constitute the full legal record, etc. So just making sure you understand all the requirements of the organization, understanding the pros and cons of each of those options that are that I talked about, and how what's the impact on cost. So understanding if I do problems discretely instead of into an archive, what is the cost going to be there to do that, and then understanding if if you have a tight timeline, how those different options are going to impact your timeline. So I wanted to take you through a case study here of an organization called USMD, and they're a large family practice multi-specialty group in Texas, formed through the mergers of MCNT, UANT, and USMD Hospital. And in working with them, part of their business plan is to recruit, integrate some existing medical groups into USMD. So with that comes the responsibility of retaining all of their data that's currently in their EMRs there. So they are actively supporting two EMR systems, Allscripts and NextGen, within the organization. And they needed to make sure that of all these practices that were integrated into USMD, that they had access to all of the legacy data from both Allscripts and NextGen. So we worked with them at the time. They had 3 integrated medical groups that needed to have access to all of their data, and one of them was on Allscripts Professional, one of them was on Practice Studio, and one of them was on Practice Fusion. So they talked with us. We told them about all their options here, took a look at the systems, let them know what was available, and they came back and said, we do have concerns about taking all the data from each of these different EMR systems and bringing them into our Allscripts and our NextGen environments. And it was really the main driver behind not wanting to do that was concerns over the quality of the data that existed between, in those legacy systems. It wasn't being used uniformly by all the physicians and the way it was supposed to. So you may have data sitting. One physician may record it in one place, another physician may record it into another. So they really had concerns about trying to migrate all this programmatically, this data into Allscripts and NextGen. Plus, then you're performing 2 conversions for this one system there. So they wanted to know what are their options here so that they can retain the data and make it accessible, but not actually physically importing their data into their target system. So the approach that we presented to them was, sorry, here. Basically, we decided that the archive does make sense for them. In their case, it made sense for all of their data. Like I said, based on the quality of the data. So they didn't, like I said, they didn't want to have to pay for 2 different conversions there and bad quality of their, unknown quality of some of their data. So PatientArchive was a really good option for them. So some of the data elements that they brought over, I highlighted here, kind of your standard problems, meds, allergies, results, scanned images, notes. So those were all migrated into the PatientArchive solution for them. And each one of these was an average implementation time of about 4 to 6 weeks to migrate that data over into their system. So the results of this project for USMD was they had archived data that was accessible in a single click from both Allscripts Enterprise and NextGen. So we gave them an integrated solution there, where we gave them a button within those systems there to to pull up all the legacy data, it helped them maintain the purity of what their flagship supported systems being Allscripts and NextGen. They didn't have to try to merge the data from those outside systems into Allscripts and NextGen. Now that is something that we do oftentimes. We do merge the data in there. But in their particular case, as I mentioned, they didn't want to do that because they kind of questioned the quality of that data. And then housing legacy data for integrated practices on a single system, it allowed them to lower their overall cost. So they didn't have to pay, as I mentioned, ongoing licensing and hardware and server maintenance for all of those 3 EMR systems that they were using before. So they could bring over the data there, free up that hardware, not have to pay that ongoing licensing, etc. And then also of great importance to them was keeping that legacy data discrete. So as they start to get into business intelligence and predictive analytics, that data is always going to be there for them when they need it to do their reporting. I'm running a little bit behind here, so I'm going to skip the next case study. I guess just very briefly, this was a hybrid conversion that we did for a medical group in Illinois of 80 physicians, and they had over 85,000 patient records, and they needed to make sure that they retain this full legal record. And basically just mention here in this case study that we used a hybrid approach of CCDs to pull the problems, allergies, meds. An HL7 interface was used to migrate the immunizations, and then PatientArchive was used for the rest of the data. And this was for a customer who was migrating over to Epic, and so we have a link within Epic there to launch the PatientArchive application. So I'm just going to show a quick demo here of PatientArchive so that you guys can see it and get a feel for it and how it works here. As I mentioned, if you have any questions, feel free to pop them in there, and as I'm giving the archive, I don't know if I'll be able to see that questions area, so I'll address those right afterwards. So let me pull up the archive. So this is a standalone version of the archive that I'm going to be showing you, where if it's a non-integrated one, where the organization doesn't have it integrated with their current EMR. However, if you were using it integrated, using it in an integrated fashion, it would take you to a page like this when you clicked on it. So this particular example, let's just say you were in Epic and you were on patient April Showers, and you wanted to see all of her legacy information from, maybe she was in, let's say the case of USMD, she existed in all 3 of those different systems. So you wanted to see, her information from all of those 3 systems, either in a combined view or looking at the data separately, what came from each of those systems. So it's nice about PatientArchive here is it allows for that. So you can see this is the combined view. You know, just have a Allscripts Medical Center here and General Hospital demo sites. So these could be, you know, the two different systems there, Practice Studio or Practice Fusion or whatever for the various legacy practices. We'll just go back to the combined view, and you can see this is just a nice historical timeline of all of their legacy data. So what's really nice about this is you don't have to click into 30 different tabs to look at, you know, to get a high-level picture of all the information that exists for that particular patient. It's all within this this timeline view here. And then if you want to kind of you know, see something in particular, let's see, I just want to see problems, you can just unclick those. So you can get a quick, nice look of everything that's in that patient chart for that particular patient. If you hover over these, you can get some of the details around around each of those different data elements as well. Let me go back here, and if you do want to see the particular areas, you know, so let's say you want to see the list there of the problems and get some, you know, more details, etc. This is all customizable here, so you can put whatever fields you'd like within here. You're not limited to anything, any number of fields. You can put as many as you want here. For sake of demo purposes here, we're just putting three fields: onset date, the problem, and the ICD-9 code associated with it. And it allows for different types of groupings and things where you can group by the reaction type, or, you know, for your allergies or whatever you like there. All of your documents and scanned images that I mentioned can be stored in a data archive. Our particular solution stores everything as, it actually leaves everything in its native format, but when it goes to render it, it renders it as a PDF. So hopefully this will pull up here. Control. Taking just a minute. Go on while that's rendering. It is a demo environment, and this is a webinar, so I do expect things to go wrong. You know, the different lab results, there's a number of ways you can kind of drill in and see all of the, you know, the details of each of those individual lab orders and lab results there. And then you can print everything out of here. So anything that you want to print, let's say that there's an allergy, you know, you want to print your allergies tab here, you can click print there, and it'll bring up your, it'll actually generate a PDF for you right here that you can then print out from here. So looks like it's working better now. So, so yeah, just wanted to show that. And then if you wanted to do a full patient chart as well, you could go right here, this button right here. And then you can click the different areas that you'd like to print into a single PDF document. So then you can, once that PDF document is created, you can then save it, or you know, save it to disk, or do whatever you'd like to do with it. Perhaps, you know, upload it into your target EMR system as well. So like I said, I just wanted to give a quick demo there to give you guys a sense of what an archive solution is and how it works. It's very slick. It's very easy to use. You know, a lot of folks tell us they like using it better than their actual EMR because it is so simple, and because also that nice timeline view that they get for each of the individual patients there. So I'm going to hop over to the questions here and see what questions you guys have and address those. So the first question here is, can you bring over financial data into the archive? Yeah, that's really a great question. So, you know, the archive that I showed you here and that I talked about, I've always, you know, been talking about just EMRs. However, you're not limited to EMRs in terms of what you can bring into the archive. You can really bring anything into the archive. You know, financial information, pharmacy information, really any lab, you know, radiology systems, etc. You can really bring any of that information into your archive here. So yeah, that's a great question. Definitely not limited to just your clinical EMR data. I'll pull up the next one here. Okay, it says, what are my options if I'm using a hosted EMR? So you know, in terms of it's not really it doesn't really change anything just because you're using a hosted system, other than the fact that you're not going to be able to get to your data yourself, or if we're doing it, we're not going to be able to get directly to that data potentially. So oftentimes, if we're in a hosted we're in a hosted situation where your legacy EMR is hosted. Sometimes the EMR vendor that's hosting your data will just dump the data out to CSV files, and then we can pick them up from there and put them where they need to be. Other times they will give us a backup of the database that they'll allow us to go and pull out of there everything that we need to pull out of the database there. And yeah, that's probably the two most typical examples. Occasionally we'll work with them where we'll remote, they'll give us access to pull from just that database for that particular customer, and we can pull the data directly out of their hosted environment there. So yeah, definitely not a hindrance to a conversion. You still really have all of your options. The only time that might be a problem is if the vendor is, I guess, being a jerk about it and not, knows that you're leaving and is not willing to give you access to that information. That really doesn't happen very often. I can't even think of a single instance where we were working with an organization where they couldn't get any access to their data there. So you still should have all of your available options. Okay. Next question is, how do you handle the patient identifier from different systems? So I assume the question there is around, the fact that we're taking different systems, we're putting it into a archive solution here, and they've got different patient identifiers existing within each of those systems. So how do we link those all up so that we know that the April showers that we're looking at here is the April showers we're looking at in each of the different systems as well? So yeah, there is a process involved in terms of mapping those patients together. We have some matching software that we use that can match up those patients and make sure that it's the correct patient. Inevitably, there's a small amount of human verification required on some of the things that are a little bit trickier there. Yeah, so typically it's just a manual or it's an automated process in terms of matching on last name, first name, social security, date of birth, etc. And we use some patient matching software for that. But then if there's any sort of need for a human to take a look at it, we will obviously get the customer involved to take a look at that. And once that's done and we have the patient mapping created, then we just it's just a matter of taking that data and importing it into our archive and making that link there for all the patients between your EMR and the archive. How am I doing on time? Just got another minute or two. Take one more question. So can you typically migrate all of the data into the new EMR? Typically not. Typically there are limitations in terms of what you're able to import into the new EMR. All EMRs are different, and some EMRs allow you to bring a pretty comprehensive patient chart in, whereas others may only allow sort of the basic problems, meds, allergies, immunizations there. I think over time, as EMR vendors become more mature in their import processes, there's going to be more and more that you're able to import into their system. But I really think there's always going to be a need for the archive, where you want to be able to retain that legal record there, but there's not a good home for it, or you can't get it into the target EMR. So yeah, I guess the answer to that is no, you probably aren't going to be able to import everything, at least discreetly, into your EMR system. Obviously, if you create a summary document, you can pretty much put anything you want in there, so you would be able to do it non-discreetly, but discreetly, you're often going to have problems. pulling everything over. So we are at the 45-minute mark here, which is what we scheduled this webinar to be. I wanted to thank everybody for joining. Wanted to mention that if you would like us to take a look at your particular situation, we're offering a free 1-hour consultation to sit down with you to talk through your particular situation, and to talk through some of the options there and see what we can help out with in terms of what makes sense for you in terms of a data migration. And if you are interested in that, you can contact Daniel Alex, and his email address is listed here, daniel.alex@healtheformatics.com. As I mentioned, I'll be sending out the recorded version of this webinar hopefully later this afternoon. And then you'll have a link to it to have the recorded version, and then also I'll be sending out the slide deck as well. And if you guys do have any questions that you'd like to ask about the webinar, you can always contact myself at brad.benson@healtheformatics.com. So feel free to send me an email or anything like that. Or if you'd like to give me a call if you have questions, you can reach me at 630-246-6821. So thank you, everybody, for attending. Hopefully this has been informative for you and given you some ideas on how to tackle your EMR data migration without losing any of your data. So thank you, everybody, for attending.